Hello, I'm Joe Lippert, the fellow at Regions EMS. I'm here today to talk to you about ultrasound. This is a new and exciting tool for the pre-hospital environment, and we're excited to share our expectations and new guidelines with you. Many services have already purchased their ultrasound device and are excited to get them implemented. We specifically chose the Butterfly and the Philips Lumify as the approved devices, as they both have recording capability, which will allow for greater ease during patient care and for better quality assurance. Ultrasound is a great tool, but it takes a lot of practice and supervision to use it properly. Once you receive your device, we recommend that you identify an ultrasound champion or champions of your service. These people should take a formal ultrasound course approved by Regions EMS. The course will focus on the background of ultrasound technology, the clinical practice implementation, and a lot of hands-on training. Once the ultrasound champion has taken the course, we recommend that this person help coordinate and encourage the individual providers to practice their ultrasound skills. Another role of the ultrasound champion will be to provide 100% service level image review. This means that every image used in clinical practice should be reviewed to determine accuracy and ensure quality interpretation. When it comes to the individual EMS provider, we recommend that each provider obtain 15 cardiac and 15 thoracic exams every 6 months. This will ensure the provider is continuing to practice and will keep up on their ultrasound skills. The skills may be obtained during patient care, during formal education sessions, or informal practice on healthy volunteers. The adequacy and number of scans should be tracked by the ultrasound champion to help make sure that we have quality ultrasound trained providers. Additional ways you can practice include holding service level practice sessions. You can always ask for the EMS fellow or other providers to be present during these sessions to help out. We encourage practice on volunteer coworkers in between calls to help view normal anatomy. You can also view educational videos on the Butterfly app or the YouTube channel. Let's talk about how to implement ultrasound into your clinical practice. Ultrasound boxes have now been added to select algorithms such as the PEA cardiac arrest guideline located below. Look for these new additions throughout the new update. Regarding the cardiac exam, our main clinical question is whether or not effective cardiac contractility is present. Indications to perform cardiac ultrasound exam include cardiac arrest, blunt trauma, penetrating trauma, chest pain, and shortness of breath. When you perform the cardiac exam, you should place the ultrasound probe in the subxiphoid region with the marker facing the 3 o'clock position or the patient's left side. Remember, your main goal is to get a good image to evaluate if there is effective contractility. If this is being performed during cardiac arrest, find your position while compressions are being performed and record the video during the 10-second pulse check. Do not prolong pulse checks for imaging. In order to improve your skills, you will need to continue to practice the cardiac exam. We recommend practicing on patients that you're getting a 12-lead EKG. They should already have adequate exposure, and you can easily throw an ultrasound probe on to look at the heart. With a thoracic exam, we're asking 2 main questions. Is there lung sliding present? And is there a pneumothorax present? If there's no lung sliding present, then a pneumothorax is a likely cause. The indications for performing the thoracic exam include shortness of breath, chest pain, suspected pneumothorax, blunt chest trauma, and penetrating chest trauma. To perform the thoracic exam, place the ultrasound probe on the anterior chest at the midclavicular line, with the probe marker facing at the 12 o'clock position towards the top of the patient. Find 2 ribs and obtain the image between the ribs. You should be able to see the pleural line in between the rib spaces as indicated on the image to the side. If the pleural line is sliding, it means there is no pneumothorax. If the lung sliding is absent, then a pneumothorax is likely. Continue the exam by sliding the probe down 2 rib spaces and obtain the same video. Then repeat the exam on the opposite side of the chest. As a clinical pearl, ultrasound is an excellent tool in the diagnosis of a pneumothorax. Remember, tension pneumothorax is not diagnosed by ultrasound, but by abnormal vital signs such as hypotension. This has been an overview of the Region's EMS guidelines for ultrasound. If you have questions, please contact medical direction. We are looking forward to the implementation of ultrasound and continuing to improve patient care. Have a good day and happy scanning.
Hi, I'm Mark Totillo with Regions EMS. This is a follow-up to Dr. Lippert's first video about pre-hospital ultrasound. The goal today is to show you ways of obtaining ultrasounds during your day-to-day patient exam. This new skill is not something typically included in paramedic scope of practice. And it's not something taught in paramedic school, and it's not something routinely deployed on our ambulances. So it's going to be challenging, and it's going to take a lot of practice to become proficient at this. The learning curve is steepest in the beginning. For this reason, we have a robust quality assurance program for pre-hospital ultrasound, which will require each paramedic to obtain 30 ultrasound exams every 6 months. That's 60 ultrasounds per year. The two main areas we'll be getting images of are the heart and the lungs. When are we most likely to get opportunity to look at these? In actual clinical use, we'll be looking at the heart to determine whether there's movement or standstill in a patient in PEA. Again, in actual clinical use, we'll be looking at the lungs to determine whether there is a pneumothorax or, more importantly, a tension pneumothorax. When practicing with ultrasound, acquiring a 12 lead will be one of the most opportune times to practice. We are looking at the electrical activity of the heart, and we can use the ultrasound to look at the physical activity of the heart. As always, patient care comes first. Don't let the practice of ultrasound delay any urgent patient care. If time permits, also try to get ultrasound of the lungs when you're taking your 12 lead. When listening to lung sounds, you can also get an ultrasound of the lungs. As you perform more ultrasounds, the time to obtain images will decrease. The quality of your pictures will improve, and your confidence with this skill will grow. We pledge to work with you to develop your ultrasound skills, but we also need commitment from you to the training necessary to do this. Thank you.